Hello, my name is Stephanie Mason, and I'm a postdoctoral fellow with the Home Care Pathways Project at the Nova Scotia Centre on Aging. In this video, I will provide a brief overview of our project and introduce how the project findings will be shared for discussion at our May 31st engagement session, so that you are prepared to participate. Overseen by Dr. Janice Keefe, Susan Stevens, and Dr. Michelle Lobchuk, this longitudinal study was carried out in Manitoba through the Winnipeg Regional Health Authority and Nova Scotia. It aimed to explore how approaches to care shape the pathways of older adult home care clients with chronic and long-term conditions through home care systems in Manitoba and Nova Scotia. Home care pathways were examined through three interrelated and overlapping streams, using quantitative assessment data, through interviews with care clients and their constellations, and by policy analysis. The data stream used retrospective quantitative home care client assessment data from 2011 to 2013, followed over 4 years, the RIHC, accessed from Nova Scotia and Manitoba regions' data repositories. The care constellation stream includes older adult home care clients and their surrounding constellation of family-friend caregivers, home support workers, and healthcare professionals. Interview questions elicited experiences and changes in care at 3 points in time over 18 months. The policy stream makes use of document review, including regulations, protocols, standards, and guidelines, and key informant interviews to analyze relevant provincial home care policies. This graphic shows the ecological framework, featuring micro-level, meso-level, and macro levels that represent individual relationships, organizational, and system responses. The project findings are situated within these levels. The provinces of Manitoba and Nova Scotia share some aspects of pathways to care, but also adopt some different approaches, for example, in their oversight, delivery, and costs. This table offers a brief overview of these approaches as of information gathered in 2021. The sample of clients in the Home Care Pathways project is similar in number across the jurisdictions. The number and composition of the care constellations is also similar. Numerous policy documents were reviewed and the program's historical evolution mapped and verified through key informant interviews. For more details about jurisdictional differences, please consult the attached provincial policy profiles. During the engagement session, we will be asking for your response to an interpretation of the project findings, which we have gathered into three thematic areas: client experience, assessment practices, and caregiver support. This slide shows these themes and also lists the guiding questions we will use for discussion. To give you a sense of the project findings related to these themes, in the following slides are some examples of findings related to client experience. Analysis of policies related to home care legislation and regulation helps us to understand findings related to client experience at the system or macro level, that is, policy. Findings raise questions about whether clients' access to home care programs is delayed. Are higher functional and cognitive needs among Nova Scotian clients the result of a program more focused on long-term care substitution than a preventative model of home care? Or is it that the program capacity is limited, or that client income testing is a barrier to access? Temporal policy analysis suggests an evolution towards person-centered care. Finally, we recognize that other health policies and services across the care continuum can affect the client's home care pathway. Analysis of home care client assessment data helps us to understand findings related to client experience at the organizational or meso level. For example, there is a higher number of home support services at baseline in Nova Scotia, but both jurisdictions appear responsive to increasing clients' needs over time. After 4 years, more Nova Scotians were transferred to long-term care, and more Manitobans continued to receive home care. While home care client visits with physicians were nearly identical in number, Nova Scotians saw more general practitioner visits, while Manitobans saw more specialist visits. Analysis of home care constellations helps us to understand findings related to client experience at the individual or micro level, that is, the care constellations. For instance, enabling flexibility to need through formal and informal arrangements is important, and home care helped not just with tasks, but also in offering reassurance and social connection during COVID-19. Clients' frustrations with services can lead to refusals and has implications for unmet need and carer well-being. Not all clients can afford private care. Furthermore, there may be differences in how Manitoba and Nova Scotia deal with difficult or non-compliant clients and families. These findings, in addition to other details under the Assessment Practices and Caregiver Support themes, will be shared and discussed both in small and large groups during the workshop engagement. Once again, here are the guiding questions we will use. We are excited to explore with you how this research can inform policy that serves the long-term care needs of older adult home care clients in Manitoba and Nova Scotia. For more details on this project, you can consult the project summary and provincial policy profiles provided with the session materials. We look forward to seeing you on May 31st. Thank you.